This video would illustrate the arthroscopic repair of a labral tear. In this case, the superior labrum as seen here. The probe is elevating the labrum where it is attached to the long head of the bicep, as you see. We're now going around the bicep from the anterior portal or hole where we enter. The camera is in the posterior back portal. We are now passing a loop that will then grab the suture and pass it, so that we then can grab the superior labrum and it will be loaded onto an anchor in order to reattach the superior labrum. There is a suture being shuttled. This is a fiber wire, very strong suture that will now loop onto itself as seen there. We now make a lateral portal with a small punch hole through the rotator cuff. You can see the cuff looks intact. And this is basically the drill guide that will go on the superior glenoid or the cup of the shoulder. This creates a drill hole for us to then insert the anchor. We will retrieve the suture again through this suture wire shuttle, bringing it out the lateral portal where it will be loaded onto the anchor. At this point, you can see with tension that the labrum is able to be reattached and the anchor is malleted into place. This is a bioabsorbable anchor and the sutures will now be cut flush. Again, this is all done through 3 small holes or portals, essentially an all arthroscopic repair. We noted that there was a portion of the labrum more anteriorly, right there, that we also decided to add an additional anchor, as seen here, in order to provide a stronger repair in this younger manual laborer who had a work-related shoulder injury. Some of the redundant tissue and frayed tissue, including this synovitis or inflammation of joint lining, is addressed with radiofrequency shrinkage. The hook probe confirms a solid repair. Now the patient will simply need to be in a sling for 3 weeks. Thank you.